And today we're going to be talking about Patient-Centered Outcomes Research Institute, named PCORI. This is a concept that is new to us. It will be new to you as well, and it is new to the healthcare community here in the United States. So we're going to try to make this somewhat interactive so that we're all learning from each other and contributing that way. And I think that's even one of the, I'd say one of the things about, or positive things about PCORI is that involvement and engagement. So we're going to show that even within our interactions as we go on. All right. So my first question to you is, what does patient-centered mean? What does patient-centered mean to you when somebody says, I'm being patient-centered or our facility is patient-centered? What does this mean to you?
I think a lot of it is giving the patient a choice of maybe treatment modalities, that sort of thing, having them kind of input into what they want to do.
So taking the preferences of the patient. Okay, very good. Anybody else? What does patient-centered mean to you? There's no wrong answer at all.
It means the patient comes first.
Absolutely. Absolutely. All right.
Since the patient's in the center of the decision-making process, not the historical providers being the ones making the decisions. The patient is driving the care.
Absolutely. So we're putting our patients first. We're taking the preferences of our patients into consideration. Patient-centered. Anybody else? What does patient-centered mean to you?
Still paying attention to the patient. I know with the electronic health record, sometimes it's easy to pay attention to the computer and not be focused on the patient.
Right.
And, we hear that a lot from family members. Oh, I'm so glad that you're paying attention to us. Sometimes I feel like they're not paying attention to us, that they're looking at the computer all the time.
Not getting caught up in our processes and our agenda and stuff like that, making sure that we don't forget that the patient's the reason we're there and what's best for them.
Absolutely. All right, very good. We all have great definitions of patient-centered, and we're all right. It's all about putting the patient, like you said, at the front, taking into consideration their preferences in everything that we're doing. And here is a definition by the Methodology Committee of PCORI, saying that patient-centered means providing that care that is respectful by paying attention to them and not our computer screens, responsive to their preferences in decision-making needs, processes, and the individual values of the patient. Again, putting the patient up front, taking into consideration their characteristics, taking into consideration their preferences in what we do. All right, so our next question then is, what does patient-centered outcomes mean? So we have patient-centered, we understand that that's all about the patient, we're taking that into consideration. From our knowledge of what outcomes might be, what would you say to you patient-centered outcomes mean?
And I think sometimes we get caught up in our outcomes, our goals for the patient, for their blood sugar to be this, or them to achieve this, or whatever. Patient-centered outcomes. Maybe the patient's idea of success in this whole thing is completely different than ours.
Absolutely.
And so patient-centered outcomes has to do with what is the patient's goal for our care.
That is exactly on point. It is about the goals of the patient, the outcomes, the results, what we're looking for, the end product, the end goal of this entire process. But we're making it patient-centered. So taking the perspective of the patient, taking into consideration the individual values to shape our outcomes based on that. Absolutely. So some things we came up with is outcomes or results that are directly affecting the patient, we're talking about outcomes or results that are benefiting the patient, and outcomes or results that are strictly relating to the patient. And it's really going to sound redundant. We're going patient, patient, patient all the time, almost in every slide, but that's the idea of PCORI, patient-centered. The more patients we say, the more it is we are thinking about the patient solely. All right, another question. So patient-centered, we said it's all about the patient, putting them up front, getting their preferences, getting their ideas, and all that. Patient-centered outcomes, we said, is modulating the goals or our outcomes or results based on our patients and what they want and what they need. So if I say patient-centered outcomes research, what would you think that means? So we have patient-centered, we've established our outcomes, but now we're including another word, patient-centered outcomes research.
So that would be research that's based on and including the patients, as opposed to pharmacology research, as opposed to a research paper that someone chooses as part of an assignment. So it's back to being all about the patients, taking into account, like you said, their preferences, their needs. I mean, outcomes research has been around for a long time, but putting the patient in the center of that rather than the needs of the researcher, I think is what we're looking at.
Absolutely. I mean, we've talked about the patient-centeredness, getting their perspective. We want their goals to match the patient and people that are going to achieve these goals, but we want to include them in our research process. We want them to be part of it. We're trying to engage our patients through the research process, really making it patient-centered. At every aspect, we're including our patients through that so that we do accomplish the goals that's set out for them. So it's not just them telling us, I want to have a blood sugar of 100, or I want to be able to walk so far. That's my goal. But it's how are we going to get there, including them also in that process of the research. Some points we have on here. It's getting the patient's perspective in conducting your research. It's producing and promoting this high integrity research as it's guided by patients, it's guided by caregivers and the broader healthcare community. It's conducting evidence-based research that's unbiased, because you're not just getting the researcher's perspective, you're getting the patient's perspective, you're getting your sample population, you're getting the people that this is affected, so it's unbiased. It's applicable to most patients because you're using the perspective of these patients. And it also yields results that address the real concerns of the individuals facing the clinical decision. It's just like someone had pointed out before. We have our goals, there are things as healthcare providers that we think is good or best for our patients. That might not be their real situation and what they really want. So this way, with patient-centered outcomes research, we are addressing the real concerns of the individuals, which are the patients that are facing these clinical decisions. And it's, again, engaging the patient in every step of the research, while selecting the research question throughout the study, the design process, implementation, the findings, and all that. And we understand that our patients will not be as knowledgeable as we are, being the researchers. But that's why we're there to guide them, provide them with the required information or education that they need to be able to provide us with information and give their perspective as well. All right, so therefore, of course, to put it all in summary, what is Patient-Centered Outcomes Research Institute, PCORI? So PCORI is an independent institute, non-governmental institute that was established as part of the United States Patient Protection and Affordable Care Act of 2010. It was established to fund patient-centered comparative clinical effective research. So we're comparing two different interventions to come up with which one will provide the outcomes that we want. That's general in what we do with research. But with PCORI, it's patient-centered towards that comparative clinical effectiveness research. It also established to move patient-centeredness from the healthcare delivery system to the healthcare research. Because we work at hospitals, clinics, everywhere, it's almost a thing now. We all know patient-centered, patient-centered. All right, now we're taking a step forward. We're moving from patient-centered in that healthcare delivery process. So it's not just, oh, I'm going to pay attention to this patient while I give her her medications or while I do this for her and provide these interventions. But we're moving it towards even the research process, coming up with those goals that we're going to implement in our healthcare systems or institutions. All right, so why is PCORI important? We believe that patients have a unique perspective that can change and improve the pursuit of clinical questions. They have something to add to us. It also includes the perspective of the end users of these outcomes, like the patients, the physicians, the stakeholders. It addresses, like I said before, the actual health decisions that these end users, which are patients, physicians, or stakeholders, are actually going to face. We believe that with including the patients in this process, getting their perspective, modeling their goals to fit their needs and what they want, it's going to help with the uptake of evidence and increase the likelihood that the patients will accomplish or achieve this outcome. Because it's what they want. It's not what we want. It's what they want, and they said. We've guided them through the process, through the research process and everything to come up with the interventions that will, or outcomes that will affect them. And we believe by including them and knowing what they really want, that is going to increase their likelihood of really adopting that outcome and intervention. It's also the true representation of the patient's perspective. Some more information is, like I said, it extends past the researcher's field of view. I read in a research article that the researcher's field of view is more like a lamppost. It's only so much that you can cover. You're one individual, you're one person, and there's only so much you know. Plus, you're also doing this for patients. There's only so much you know about the clinical aspect as compared to what they actually really want. So this is going past that lamppost view of the researcher and getting a broader perspective of what people, patients, stakeholders, of what the end users really and actually want. It improves the choice of research questions. So we're not just as researchers sitting down and saying, well, what do I think is important for my community? What do I think my community needs? What do I want to research about to help my community? No. Developing a research question is based on what the patients want, what the end users want, what the stakeholders want. So it's getting that perspective. So it's improving our research questions. We're not just starting off with some broad concept and then trying to figure out what patient it applies to or who it applies to. No, we're getting the real situation. We're getting the right questions at the start. It improves the selection of outcomes also because it's going to save us time from selecting outcomes that we think or we believe as researchers or clinicians our patients want. And they go through, maybe that's not what they really want and we don't have a lot of adoption. But this way, we're improving our selection of outcomes because the patients are telling us what they want. Our stakeholders are telling us this is what we want and this is going to improve outcome selection and outcome adoption. It also promotes better, like I said, implementation and dissemination strategies for findings. The patients have unique perspectives that they add towards how we can accomplish something or how we can achieve this outcome. Because, for example, we have this that we say, if you're about to discharge a patient and you want this patient to exercise, it's very easy for us to say, all right, we have a YMCA on this street or on 19th Street. Try to go there 3 times a week and just walk around or exercise 3 days a week. Okay, the patient says, yeah, that's fine. But if you were to ask the patient, maybe she takes her grandchildren to, she picks them up after school. They like to play around at the mall. That's more practical for her. But if we get that perspective from her and say, you know what, I need you to be able to walk around 30 minutes 3 times a week, how do you think you can accomplish that? And that way she can give you your perspective and say, you know what, I'm always running around with my grandchildren whenever I pick them up from school. That way we have strategies for this outcome. Our outcome is for her to exercise, walk 30 minutes 3 times a week. The strategies on how we get there, from her perspective, will increase the possibility that she's actually going to go through with it, as compared to, yeah, just go to the YMCA for 30 minutes 3 times a week, which is or probably unlikely. And it speeds up the uptake of research into practice. We're practicing research, we're engaging our patients are getting an idea of what research means. And they're getting some practice too. And that way it speeds up that patient engagement and taking our patients towards research and also into practice for ourselves, for our clinicians, stakeholders, and everyone. All right, and I'm going to stop talking now so Holly can give you some points. Yeah, absolutely.
So PCORI, as you probably understood from what Sharon has said, PCORI aims to change how clinical questions are asked, how the answers are pursued, and how the answers are used. The goal is just for the research to keep evolving and to continually change practice, to improve and to find better ways for the distribution, or find better ways of researching things and the distribution of that evidence and turning that knowledge into action. So what and who does PCORI fund? There's many studies, many people, many conditions that it funds, studies comparing outcomes to determine the effectiveness, including risks and benefits of 2 or more approaches to healthcare. There are studies that improve the methods that are available for patient-centered comparative effectiveness research. Conditions that affect large numbers of people across a broad range of populations. There are conditions that place heavy burdens on individuals, families, specific populations, and society. Rare diseases that are difficult to study, and certain populations, racial and ethnic minorities, older adults, low-income families, women, children, you name it. There's lots of different people or conditions that they will fund. So how do you get PCORI funding? Unfortunately, individuals cannot apply, but the basis of funding is that they need to be able to demonstrate the relevance to patients. How does this benefit the patient? Engagement with the patients and the other stakeholders in the research. There's 5 merit review criteria that they must meet. The impact of the condition and the health of individuals in the population. The potential for the study to improve the health and the outcomes. Patient-centeredness, stakeholder engagement, and the technical merit are a few of the merit reviews. So here's an example of a research project, one that would be funded and one that would not be funded. Research project that would not be funded by PCORI is a proposal to study comparative effectiveness of asthma treatments for Latino youth with forced expiratory volume. A research project that would be funded is one that involves the patient's perspective, a project to study asthma treatment using forced expiratory volume and parental report as asthma as the outcome. Again, the reason that the first one would not be funded is because it does not include patient engagement, and it take a patient-centered approach in the first example. And Florida Atlantic University had a program that they created, and it's called Interact, and it's interventions to reduce acute care transfers. And it was designed to improve the identification and evaluation and communication about changes in a resident's status. And this project sought ways to involve nursing home residents and their families in decisions about transfers to acute care hospitals. And I'm going to go back to that real quick. Sorry. This was to, I'm going to go back to this one right here, I'm sorry. Again, I wanted to bring up something that Sharon had brought up about the lamppost idea. The research, the question measures, it looks beyond the questions and measures found where the lamppost within the researcher's field of view. So here they just want to make sure that it's not just the researcher's field of view, but also includes the patient's field of view as well. So who are the stakeholders? The stakeholders are anybody from the patients to the family members to the caregivers, the healthcare purchasers, hospitals, policymakers, researchers. And the way that they engage the stakeholders are they have focus groups that they have everybody attend, interviews with each of the stakeholders, and online forums where everybody can participate. And here we have a video many of you may have seen, but it just it ties everything in, and it just shows you the importance of hearing and seeing each other and seeing the patient as a person in the...
We are here in a hospital, in your office,
in my office,
where I am your patient.
where I have many patients.
I came here today for a checkup, to check in with the hope you can help me feel better.
I come here every day to make people feel better, for checkups, to check in with the nurses and patients I care for.
I came here for answers about my illness and pain. I'm afraid of what you might find, afraid you may not find
An answer. It is my job to find answers. I went to school for much of my life in order to care for yours. It is my job.
We are here in a hospital, in your office,
in my office,
where I am your patient.
where I have many patients.
I am more than my cells, more than my chart can tell. I have a wife and children, 4 grandchildren. Please see me.
I have a family too, people I care for, but I am here to care for you.
The hospital is large, full of people waiting for their sickness to be named. Do you remember my name?
Yes, I remember you, though often I am tired. I leave for work too early and get home too late. I have a long list of patients to see and not enough hours in the day. I'm not a god.
Please see me. Everyone hurries here. I'm afraid to ask a question, or I forget my question and then you are gone. I need to know what might be wrong.
Please talk to me. I want to have the answers. I studied years for this. I learned the names of every bone and muscle, of diseases and how to treat them.
I am not a doctor. The names of pills and procedures sound boring to me. But this is my body. What will this medicine do to me? How much do I owe per pill, per minute of your time? Please see me.
I read your chart, your family history, but I need your help to understand what paper cannot tell.
Please help me. I want to be healthy, but I need to know that I can trust you.
Please don't be afraid. Talk honestly to me.
I am here. I am your patient.
You are my patient.
Please listen to my story carefully. Care for me.
I want to hear your story, to care for you.
Help me understand. Give me the tools I need to be healthy,
To help you stay healthy,
to be a partner in my care.
to be a partner in your care.
Please see me. I am your patient.
You are my patient,
I am here with you, a patient.
a doctor,
A person in your office,
in the hospital,
We are working to get better.
to be better.
We are working, patient and doctor together. Please see me.
Does anyone have any questions? If there's anything that you do want to know about PCORI, that you can go to their website, it's pcori.org, and they have a wealth of information on there that will answer any questions you might have.
Make Frank big.
We'll take Frank out of the corner.
Frank, you're coming out of the corner now.
All right.
We're gonna try and do that anyway.
Okay.
Okay, you're big now.
All right. Everybody can see my beautiful face. All right, well, this is very interesting to hear, and I'm very glad that you all had the opportunity to partake and really listen at the Summer Institutes about what's going on in the national level in terms of engaging patients, not only in their own healthcare, but in research. And that video that you just saw, that Please See Me video, it's a great video in that when I see it, the first thing that comes to my mind is perspective, okay? And you realize that there are different perspectives in healthcare, from the nurse's point of view, from the physician's point of view, from the pharmacist, down to the patient, and even all the support staff that are around. So when you think about these varying perspectives in healthcare, it's a wonder and amazement that we've gone through so many years trying to understand healthcare delivery processes and improving it from just a single lens, and not really doing a good job in integrating multiple perspectives. And that's a lot of what PCORI and current national trends are trying to do, is how do we integrate the voice from different areas? And you start to think of really two key terms that I just love, and that's empowerment. How do we get people that voice, the feeling that they're making a change? And then partnerships. How do we link people together to share that voice, all right? And so with PCORI and other initiatives, you get these partnerships coming from working with researchers, working with clinicians, working with patients and other stakeholders that are really gonna help create a wonderful view of ways that we can improve things. Not only improve system processes, but ultimately study things that the patient cares about. And I love the examples that you brought up during your all's presentation that, we know what it means to be patient-centered. Of course, nurses know what it means to be patient-centered. You all are the point of care for nurses, for the patients in the healthcare system. But now, what does it mean to have patient-centered outcomes? These outcomes that patients are really more concerned about and feels that they may need to have a larger focus in terms of their treatment course and things like that. So when you think about it, maybe the literature will show and demonstrate that an effective treatment is really good at managing one course of illness or better at improving one's outcome. But when you look at it, the quality of life or the things that the patient is experiencing is not something that they really want to encounter and go through, and there must be a better way to have a better outcome, that the patient, one, is happy with a different quality of life, and two, has a better treatment response. So you got to take into this holistic view, I guess is what I would call it, of working with individuals. So I think the way you presented that was just beautifully stated, and something that I think the PCORI is really trying to push forward as a national agenda. We spend so many times going through various waves in the research world, and they're all very relevant and important, from the clinical research and improving therapeutics and drug treatments to the organizational improvement and quality improvement, and how do we fix healthcare delivery systems. But now, what's been missing all these years is that patient voice and that patient perspective. And with PCORI's major focus, it's not only just to have the patient tell us in a research study what they want, but it's to engage them as full partners. And so when you brought up that slide earlier that talked about what type of funding or what is PCORI funding, they're really looking at a research team that is, one, interprofessional, but two, has a patient representative early on, so they're helping you craft your research question. Again, having those multiple lenses, looking at a particular phenomenon, and how can we move forward with it. So I love that you highlighted these things and you're sharing it with your colleagues there, because these are the type of informations that we want spread out, that we want people to consider as they move forward with their academic careers, with their clinical practice, and eventually with their things that they do in education, development, and all that. One other point that I wanted to bring up too is that this opportunity for disseminating and implementing things, and you guys touched on it a little bit, but another huge objective with PCORI is to actually have the research findings that are being developed, that are being identified, that they're presented in a way that patients can take them back and actually use them. How often is it that we probably know of a clinical outcome or a treatment effect, or maybe some program to help improve some quality of life or some health lifestyle, and it's never really communicated back to the patient or to the appropriate stakeholders, and it's not packaged in a way where they can readily use it. So that's the next step. We're generating new knowledge, we're creating new interventions, but now how can we package this in a way that a patient can utilize it? So those are kind of like the main themes I just wanted to reinforce, and I think you all did a wonderful job introducing that and sharing the things that you learned. This is a new perspective for a lot of people. It's probably been in our minds a lot, but it does change the course a lot in terms of how do we engage in research. And it might be a little uncomfortable at first because we're not, one, used to collaborating very well, and we're learning better ways to do that. But then we're also not very used to incorporating the patient's voice that early on in a development of a project or a study. And so there's a lot of methodologies that PCORI is starting to develop, and I would encourage you all to maybe think about reviewing that. There's a methodology report that you can download from PCORI's website that has a lot of useful things that you can integrate into your research courses as educators and incorporate into your studies as scientists and researchers that, one, is going to help you align with PCORI's movement, but then also makes you a very prime candidate to develop your programs of science and research or your educational interventions to really be attractive for PCORI funding. So I feel like I've said a lot right now, so I'm going to take a pause. But I just wanted to get a lot of this out before I forgot.
You may jump in, and I'll bring up the rear.
I have a unique perspective on this because I've been a nurse for a lot longer than some of you who've been alive. As a matter of fact, I have celebrated 43 years in nursing last spring. And I want to share a little story with you. When I was 18 and heading off to nursing school, you remember that moment before you head to nursing school. And I was 18, and you may or may not remember what it was like when you were 18. But I spent hours one day trying to figure out how I was going to do my hair so I could wear my cap with my uniform. And I kept going upstairs and doing a hairstyle and coming back downstairs to my mother. And about an hour and a half into this, she said, "My dear, this is not about you." You see, my mama was a nurse. My mama was born in 1928, and she went to nursing school in the Army Nurse Corps. So she would have graduated in about 1948. And I was lucky to have grown up in a family of nursing because patient-centered care was what we did. We exist to serve the patient. Let me say that again. We exist to serve the patient. All the things we do, the charting, the procedures, the giving report, are all transitioning into making it easier for us to serve the patient. A great example of that is nurse-to-nurse report at the bedside. That is patient-centered care. We used to give report in a room or at the nurse's station, two of us together huddled going over, yeah, he was a little crabby today. I mean, I don't mean to say that, and his bowels moved. I mean, all the important things that we say. Went through the 76-year-old patient who was admitted for it, and then we move on to the next patient. And so now, not only have we incorporated patient-centered care into what we're doing, another great example of that is a JACO standard for patients who are placed in isolation. How many of you love taking care of patients who are in isolation? Well, here's the other side. The patient is in isolation, and what isolation means is they're separated from other patients and other caregivers. And to show them that, we put on all kinds of garments and masks and gloves before we go in the room. How many of you have ever done that and not really told the patient what you were doing? Yeah. And so now under the JACO standards is a patient who is placed in isolation, we must document that we have told them that they were in isolation. We must document the education that we give them, and we must document that we have educated the patient. Family-centered care. And so we move from that to talking about outcomes research. In about 1947, Ignaz Semmelweis looked at the association between puerperal fever and the absence of aseptic procedures. And those were doctors who didn't wash their hands before they delivered babies. And then he looked at that with the use of calcium hypochlorite to decrease risk. This is one of our early examples of outcome research. Semmelweis' results were not accepted until after his death, when the theory was then validated. In the early 1870s, a woman that we're all familiar with, Florence Nightingale, began to initiate research. She made a list of patients who died, the reason they died, and how they died. Now, this was a retrospective study, but it was also a prime example of outcomes research. We've been doing this for a long, long time, but now we're adding in something different, and that's making it patient-centered. For a long time, research was the result of an assignment, what you had to do to get the next level of your education. I was visiting with a patient the other day who had been placed on an inhaler. And she got the little bottle, the little box with the inhaler in it. And in the inhaler was the folder that you open. And her prescription box said, use 1 inhalation a day. And on the sheet that she opened, it said, indication 2 inhalations a day. Well, as we went down and looked at that, and you got to the bottom, that was a research study done by a pharmaceutical company. And when you looked at the particulars, it was actually applied to 60, there was 60% evidence that this was effective in this group of patients. Our question is, what about the other 40%? The other 2/3? Was this outcome-based? No. Was it patient-centered? No. And so we've come a long way. PCORI is a relatively new subject for me. I've had the experience of getting to know it over the last few weeks before this invited response. And I think you have done an excellent job in your presentation. You took everybody from maybe this much knowledge to a greater sense of knowledge by the way you defined it, by the way you applied it, and by applying your passion. And Dr. Puga, the way you responded is phenomenal because you took it from the literal sense into a larger phenomena and made us look not just at the small lamp that we saw, but through a huge lens and allowed us to see that this has so much more than we thought it did at the very beginning. So thank you so much for what you did. Thank you, Dr. Puga. You did an amazing job with that.
I appreciate that. Thank you. And
You are so welcome.
this was great.
Dr. Wong.
Yeah, I just want to thank everyone who's here today. It's really nice. While our numbers aren't huge, we've got both hospitals, we've got clinicians, we've got educators, we've got folks from Texas Tech, It's a great age that we're in, that we can say, on the screen, we have a colleague from UT HSC in San Antonio. In the audience, we have clinicians, nurses that are at the bedside, that I hope that there's been something said today that stimulates you, because there's something here for every single level. And isn't it wonderful to have the opportunity to learn from each other? So thank you, Dr. Puga, for bringing the Improvement Science Research Network to us virtually. Thank you to our graduates for making us all proud. And okay, our students in the audience, this is what we want you to look like in just a little while, okay? Right here, they're right up here. Going to conferences, presenting at conferences, but not stopping there. Bringing it back, disseminating it here, putting it into practice. You know, tomorrow, go back to your practice and think about what you learned today. What can you do differently? What question can you ask differently? And to our amazing alumni who, you know, continue to show up and help us make these things possible. So just sure appreciative of everyone being here. Our dean in the back who just comes to cheer us on, not even in our college, in a different college. Faculty in the back, and then of course our webmaster Justin. By the way, this is all going to be available to you on the Nursing Center of Excellence webpage as a YouTube presentation. It will be posted within just a couple of weeks. So if you want to go back and review it, or you want to share it with somebody, just go to our webpage and you can click on it and watch any portion of it again. So thank you so much for being with us today and bearing with us through the trial, Frank, and to our graduates, Holly and Sharon. Thank you so much, and our alumni and our guests. So glad you were here today.
Thank you.